Good afternoon, everybody. I'm Dr. Misty Paul with Basics First Chiropractic. Thank you for joining us today on our Wellness on Wednesdays, our WOW Lunch and Learn. Today, I have the great opportunity to introduce to you a wonderful friend of mine, Meg Tiffany. Meg and I have known each other for many, many years, and we are colleagues when it comes to doTERRA essential oils. So Meg, thank you so much for joining me today on WOW, and tell us a little bit about what's coming up.
Thanks, Misty. I'm so happy to be here with you today and to present with you on managing pain, specifically low back pain. That's going to be our topic today. I'm going to go ahead and share my screen. 1 second. So
okay, great. So as you are sharing your screen, I'll just say a few more words. We at Basics First love to treat low back pain. We know we do that well. Both Meg and I have low back pain that we have to deal with. And one of the things that we like to teach people is that it's not just as important for you to come into our clinic and receive the care. That's extremely important, but we want to give you some tools of what you can do at home to take care of yourselves. So that's a little bit about what we're going to be talking about today, Meg.
Yeah, home care and learning how to provide self-care for minor aches and pains, managing sort of if you're someone like I am who has chronic pain, or, you know, I go out and I garden for 12 hours in a day and gosh, for some reason I'm sore.
Yeah.
You need to manage that. And I don't necessarily have to go see a doctor or something. I can manage it with the right tools in my little toolbox at home for self-care. So can you see, I just want to verify you can see the screen.
I can, yes.
So let's get started. Oops. And let's talk about common areas of pain before we get started. So actually, I think I went too. I didn't. Low back pain, which is what we're going to focus on today, including low back pain with radiating pain down the sciatica or sciatic nerve. We're also going to be talking in our schedule of our WOW schedule, neck pain and headaches. We'll be talking about that next week. So that's going to include neck pain with pain radiating down an arm, jaw pain and vertigo. And then the following week, we're going to address and discuss upper and lower extremity pain, including tendonitis, carpal tunnel, and plantar fasciitis. So those, that's sort of the lineup of our Wellness on Wednesday, our WOW Lunch and Learn schedule for the next few weeks.
Wonderful. Seems like all sorts of common symptoms that come into Basics First. So I like it.
So I just want to spend a few minutes talking about how our backs are sort of designed. It comes in 3 sections. And as you can see from this diagram, this top part in red is the cervical and the cervical section of the back. And symptoms related to that include neck pain, arm and shoulder pain, headaches, numbness, and tingling in the arms and hands. The second section, this long yellow section, is the thoracic section, and that includes rib and mid-back pain. And then one of our more common forms of pain is in the lumbar section, this purple section here. And that's the frequently referred to low back pain. And that can also include pain and discomfort in the legs, accompanied by numbness and tingling in the legs and or feet. Misty, would you like to add anything to that?
No, you know, I love this diagram, and I love how you have given the different areas of the spine different colors. I just want to make sure that our audience understands that although we're going to be focusing in on the low back area today, it doesn't mean that the the tools that we will be providing to you, giving you, you can't use in other areas, right? It's just confusing to talk about the whole spine all at once. So I like that you've broken it up for us, Meg.
Yeah, there's a lot of overlap in what we're going to be talking about with different parts of the body in terms of the tools you can use to manage discomfort and pain. So I totally support that, but to try and tackle the entire back and where it goes in the body is too much to do in a quick 30-minute lunch and learn. So
Yes.
let's continue on. So I think you'd like to talk about this one in terms of defining what low back pain is and what causes it, Misty. So I'm going to let you talk to this slide.
Sure, absolutely. Meg, when we started out this conversation, you mentioned that you had worked out in the garden. I had done the same thing this past weekend. Um, Also, I went on a bike ride. So there's several things, activities that we do during the weekend, the weekdays that might cause some of the low back pain that we're experiencing. There are several people of late that are in the process of moving, whether it's moving kids out of college or to college, or just simply transitioning from one home into another. That causes heavy lifting. Uh, Maybe you've suffered from some kind of a trauma, an auto accident, or the thing that we're all very familiar with today is sitting for long periods of time while we're looking at a screen, right? All of these things, the frequent bending over, all of these may cause low back pain. It's something that can be aggravated by the existing condition of your spine. You maybe have some inflammation that's underlying due to some arthritis. We also call that degenerative joint disease or degeneration of joints. This can be referred to in many different ways. If you have narrowing in the spinal canal, we call it spinal stenosis. If you have a disc that's starting to narrow or decrease in size, we call that degenerative disc disease. It's all basically under that same umbrella of some type of degeneration is going on, whether it's caused by age or not, or by a trauma. All of that can give us low back pain as we know it.
So we were also going to talk about low back pain and the impact it can have on the sciatic nerve.
Yeah, absolutely. So we're all very familiar with that, of either a definite shooting pain that goes all the way from the low back down to our feet, sometimes the toes, or just the sensation. Some people call that sensation, maybe they feel it as a burning. It can be. It can be a sensation of, I keep on looking down because I think there's water pouring down my legs. And all of that is possibly related to the sciatic nerve that starts at the lower lumbar area and it travels all the way down, depending on the severity of the issue. That pain can either go halfway down to the buttocks, to the back of the knee, or simply all the way down to the foot. It can be caused by tightness of muscles. It can be caused by narrowing of the spinal canal. It can be caused by a disc issue. But regardless of how it's caused, we can help those symptoms, can't we, Meg?
Yes, ma'am. So I'm going to spend the next couple of minutes talking about a couple of doTERRA products that can help manage that lower back discomfort and pain. So we're going to talk about the Deep Blue, particularly the Deep Blue Rub, and we're going to talk about another product that doTERRA has, which is called Copaiba. You'll also hear it referred to as Copaiba and a few variations on that pronunciation. Lots of people struggle with it. So Deep Blue is one of doTERRA's most popular and best-selling products because it's so effective. It's a powerful essential oil blend and it offers immediate soothing relief to sore joints and muscles. It also supports a healthy immune response It provides that warming and cooling at the same time, an invigorating kind of sensation. And that's because of the components, the oil, the pure essential oils that make up this blend. And we're going to, the Deep Blue is a product line. So you can see it has this oil, which is a smaller bottle. It has the Deep Blue rub, and it also has something called the polyphenol complex. Today, we're going to focus just on the Deep Blue rub. So I want to talk a little bit about how this rub works and why it's so effective. So of the essential oils that make up this blend, several of them are categorized as being anti-inflammatory, and inflammation is generally what causes our pain. We feel that pain because something somewhere is inflamed. And so we want to drop that pain and that discomfort. And so all of these various components, the wintergreen, the camphor, the peppermint, etc., are all categorized as natural anti-inflammatories. A few of these are also, these same oils and a few different ones are categorized as being analgesic. So that helps relieve pain, analgesics do, but this is a natural form of it. They're also antispasmodic. Peppermint and helichrysum are antispasmodic, so it helps support the relief of muscles that are in spasm. So you want them to relax so they're not causing that pain anymore. Anti-rheumatic for people who suffer from rheumatoid arthritis. Neuroprotective, so help calming the nerves, because that's how we feel pain, is through our nerves. And then vasoconstrictor to help lighten the blood flow into the affected area so that it's not getting too inflamed and too swollen, so that it can actually heal. So managing that blood flow more effectively. Misty, do you have anything to add to that?
Well, what I love is that it's an anti-inflammatory. It really, when we talked about how sciatic nerve comes about and the low back pain and how it can be caused, and this product takes care of the muscles, the joints, the nerves. And I know you also mentioned that it's great in terms of heating and cooling. I love this on both people who have chronic issues of low back pain, also the acute person that comes in that says, oh, I'm still in that use ice. Well, this is great. You can use this along with ice as well.
Thanks. All of that is very true. And we're going to talk about how to use these products in just a second. But let's talk about the other product that we really think works well for managing discomfort in the lower back, and that's Copaiba. And so Copaiba, it comes in a soft gel format, so you take it internally. It also comes in an oil formulation. And when you take it internally, I'm going to walk through some of these points. So it can really help support a healthy immune response. And you hear that term, healthy immune response. What do we mean when we say that? So the example I love to use is, you hit your thumb with a hammer and you might say some bad words and jump up and down a bit, and your thumb hurts and it might swell up. Well, that's your body racing to the area to help protect it and start the healing process because you've injured it. And once you are past that acute stage, as Misty referred to, the swelling goes down, the bruising goes away, your thumb starts working again, and it's all better. Chronic inflammation is when that inflammation doesn't go away and it stays there. And we want to avoid being in that chronic inflammatory state, because chronic inflammation is the root of most diseases today. So this particular product is very good at helping support a healthy immune response. as well as providing support to the cardiovascular system, again, the nervous system. And when you're in pain, you can also get anxious. It can help calm the anxiety that goes along with pain and injury. And the other thing that's great about it is Copaiba does not contain any of the psychoactive cannabinoids that are in the all-famed CBD oils that everyone talks about and uses. This is very well controlled, and it doesn't control that type of the psychotic part of the essential oils. It is again categorized as being anti-inflammatory, anti-arthritic, analgesic, and it's also a very powerful antioxidant. So it's quite protective to our systems as well. Misty, would you like to add anything?
Everything that you said was just so great. And while Meg was telling you all about Copaiba, I was thinking to myself, oh, I'm going to add A, B, and C. And of course, you've already added that. But one of the things that I do want to point out is that this product comes not only as a soft gel. So the little bottle that you see has soft gels in it that you would ingest, but it also comes as an essential oil. It's great to have both of them, right, Meg?
Yeah, and you can use them both at the same time. You can use, take a soft gel in the morning or two, and you can apply the oil. And we're going to talk about that in just a slide or two.
Okay.
So we're trying to cover the, why, what, when, how, what, when, how, about these issues and the products we can use to help manage them in a safe and effective way. So how often do you apply Deep Blue Rub and Copaiba essential oil? Well, the rule of thumb is a little bit more frequently is better than a whole lot less frequently. The reason being that your body can only absorb so much and put it to work. So when you use a lot at one time, your body just can't use it because you don't want to overwhelm it. So a little bit more often keeps it moving in a steady state throughout your body, and provides you the best support. Now on the gel caps, there are directions on what they recommend using, what doTERRA recommends using based on their development and testing of the product. So I highly recommend using as directed. And as you need it for topical application. Some people may need to use it more often, and some people may need to use it a little less often. People vary in their needs and their degree of pain management. Misty?
So we are so accustomed to when we take medications, whether it's over the counter or prescription, that we're supposed to take it every 4 hours, every 6 hours, no more than so many capsules in 24-hour period of time. We're constantly doing the math, keeping a log. Essential oils don't work that way. They're natural. Your body looks at it as a natural form of remedy. And this is why it is important to make sure that you're not using it. This is not a situation where if a little bit helps, then use a lot more, but rather use frequently.
Yeah. Yep. Okay. So we were talking about, where do you apply it? You apply it where it hurts. Topical application always goes wherever the pain is. So follow the pain, put some Deep Blue or put some Copaiba, and you just rub it in. Where do you apply it? It doesn't really apply to the gel caps. They go in your mouth
Yes.
with water and down in your stomach so you can get some healing from the inside out. How do you apply? So you apply, just put a little bit and just rub it in your lower back. For additional support, you can use these two products, the Copaiba oil and the Deep Blue Rub, together. And the way you do that is to apply the oil first, rub it around the area that is bothering you, and then seal it in with some of the deep blue rub. And the advantage of doing that, the benefit, is that that deep blue rub will help with a deeper penetration into the tissues. And so you get somewhat greater relief. I am a big fan, although not everyone likes this. I like to take a hot bath or a hot shower so that my pores are open, and then I will layer my oils. For some people, when you do that, the deep blue rub can kind of feel like it's burning your skin. It isn't, but it can really give you that. We talked about the warming sensation earlier. It just raises that up a notch if your skin is already hot and the pores are open. So it can feel a little more on the hot than the warm side when you do that, but it's very effective. A note, wash your hands thoroughly after applying deep blue anywhere on your body, because it does have peppermint and other oils in it that you don't want to get in your eyes. So, you know, if you suddenly have to rub your eye after putting on deep blue and you haven't washed your hands, it's not going to feel good at all.
That's
Anything
right.
to add?
So I love using the two products together, the Copaiba and the Deep Blue Rub. In fact, most patients that have come into our clinic have experienced me doing just that on them. The reason that I love using the two products together is my personal experience with myself and my family. It works beautifully. The second is that there are some studies done by the NIH. And for those people that are interested, please just email us at Basics First or Meg, and we'll get those studies out to you. But they've actually found that when you apply the two together, you get some wonderful relief. So
yeah, they work synergistically together to sort of amplify the management of pain.
absolutely. You know, some people, I will add one more thing, and that is that Deep Blue Rub has, as we know, it's a blend of all the individual products that Meg has already talked about. Peppermint smells amazing. All of the other products in it smell amazing too. It also has camphor in it. Some people are not crazy about the camphor smell, and therefore they sometimes will say, I like how Deep Blue feels, but I don't like the smell of it, or I'm afraid other people might smell it on me. If you are one of those persons, Copaiba is a great product for you. You can use Copaiba all by itself and you'll get lots of relief with that.
Yeah, and the other thing I want to point out is that although you smell it when you first apply it, it dissipates really pretty quickly. You don't smell it an hour later, or even a half an hour later. It really does absorb well. It doesn't leave you feeling greasy, and you can go about your day and people aren't going to be like, oh, who's that person who smells like wintergreen walking around, or camphor?
Yes.
So just a note on that. All right, so I want to talk about a few. I'm not going to go into detail about these products, but I want to make a note that, you know, just like when we take medications, some people can take some medications and can't take others, or they're not effective on one person where they're very effective on other people. Essential oils work the same way to a certain degree. And so some people might get more relief by doing a different combination of oils. The two that we focused on today, the Deep Blue Rub and the Copaiba products, the soft gels and the essential oil, are the most common, and most people get the most relief. But if you don't have that, or you need a little more support, there are some other products here that doTERRA offers that also are very good at managing and supporting the relief of pain and discomfort. So if you have questions about that, you can always talk to Dr. Paul or me. So how do you get the products? We always want to let you know if we can get relief to you quickly. Obviously, you can get them through Dr. Paul's clinic at Basics First Chiropractic. We really encourage you to talk to Dr. Paul or talk to me about these. If you're on this call, you know how to get a hold of Dr. Paul. My telephone number and my email address are here if you'd like to talk to me about them. And then to purchase the products, you can go to this link right here that's right here in the slide. Just get your cell phone out, take a picture. And then when you get to checkout, after you put the products in, if you enter this code, you will get a 10% discount on the cost of the products. So one thing I do want to point out as well is many people like to go to Amazon to buy their products. You know, I buy things, everybody buys things from Amazon, especially after this last year. However, please do not buy your doTERRA products through Amazon. Amazon is not a reseller of doTERRA products, and people who have gone that route, there have been reports of rashes and other side effects that have occurred because not everyone is as honest as we'd like them to be. And the products that they're purchasing are not actually doTERRA products. They've been tested, and doTERRA is trying to manage this problem. But I just always want to put that note out there that you may not get actual doTERRA products if you buy them through Amazon. So in summary, we want you to have pain and discomfort relief. We really completely support the use of certified pure therapeutic grade essential oils, and that's what doTERRA essential oils are. They are tested by independent scientific companies that are totally independent, do their own testing. You can actually enter your lot number that is on the bottom of every bottle into a website, and it will tell you the test results of all the latest scientific ways of testing things and what the test results are for that lot that your bottle came from of oil. All oil that doTERRA produces is tested. They sell nothing that doesn't pass their very high standards. So therapeutic grade oils provide a non-addictive and very effective alternative to the pharmaceutical products that we all know about. But what's nice about these oils is you don't have side effects. None of those bad, nasty side effects. Again, I've repeated here, if you didn't get your camera out in time to get the link to how to purchase them and how to get your discount, it's right here. And then if you'd like to follow us and attend our Wellness on Wednesday Lunch and Learn programs, this is the Zoom link that we'll be using. So get a picture, and this is the meeting ID. And we'd love to see you at 12:30 every Wednesday. And if we're not going to have one, we will let you know ahead of time. Misty, I don't know how you're managing that, so I'll let you talk to that.
Sure, absolutely. So please, we'll try to put notifications onto the Basics First Facebook site as well as the website. You can always ask at the clinic to feel free to contact us in any way that you feel the most comfortable. But we are also recording these Zoom calls so that they're available for those who can't get right on. If you have any questions for us, you know how to get a hold of us, and we hope that we've wowed you today on our Wellness on Wednesdays. Thanks for joining.
Thank you, everyone.